Life is good here in the Lowcountry, and one medical provider is working very hard to make sure that it stays that way. St. Joseph's Candler has been providing advanced medical care to citizens of the Lowcountry for decades. Known for their highly skilled medical personnel, their commitment to breakthrough treatments and state-of-the-art technology, St. Joseph's Candler offers a wide variety of programs and services to treat illness and promote wellness to all of the citizens of all of the communities it serves. Today, we're taking an inside look of one of the many ways that St. Joseph's Candler is improving the health and well-being of the region. This is Living Smart in the Lowcountry. Today we're taking a closer look at medical oncology services. We'll be talking to several physicians about some advancements in certain treatment strategies and what those actually mean for some oncology patients. Let's get started. This is Living Smart in the Lowcountry here at St. Joseph's Candler. Dr. Heidemenis is joining us now. We're going to talk about personalized care, a really important component of care here. How are you today?
I'm doing well, thank you. How are you?
Thanks so much for joining us. I'm doing great. I want to talk about this. This is really important stuff. First, we're going to start with really talking about what medical oncology is in comparison to, different treatment types of oncology.
Yeah.
So what is medical oncology specifically?
Yeah, medical oncology is a medical specialty focused on utilizing medications, typically things like chemotherapy, immunotherapy, and other medications to help treat cancer. Typically, we are experts trained in diagnosing cancer and also formulating a treatment plan for each and every one of our patients. We also take a responsibility of helping shepherd care with our patients in terms of facilitating appropriate referrals and involvement of other medical specialties too, including surgery teams, radiation oncology teams, and pharmacy teams as well.
One of the things we really want to dive into today is what you mentioned just a moment ago. It's personalized care. So talk to us about what that means in comparison to maybe standard care.
Yeah, our approach here with SJC, the Bluffton Medical Campus, is to provide a comprehensive and effective treatment plan for all of our patients. What this typically involves in a personalized approach is both formulating an effective and concise treatment plan for our patients, but also taking into consideration their underlying medical problems, some medications they may be on before their cancer diagnosis, and also incorporating this into both their physical, emotional, and also their spiritual well-being.
Wow, really covering a lot of bases, of course. Let's talk about what that means for the patient. So what's the main benefit of such personalized care?
Yeah, our job here is to provide a comprehensive approach for all of our patients. Cancer care is complicated these days, and it involves both cancer treatment with medications and surgeries and various other modalities, but also an approach on the patient's physical well-being, emotional well-being, and spiritual well-being. So our approach in terms of a comprehensive approach involves social workers, nurse navigators, spiritual counselors, who are also be able to involve in a comprehensive approach for our patients.
Wow, incredible. Let's spend a little time talking about this particular building, this space. How does that really apply to treatment and how the patient outcomes might be?
Yeah, the SJC, Bluffton Medical Campus, is truly a remarkable building. It was built to kind of instill a comprehensive approach for our patients. So basically, this is a one-stop shop of sorts for cancer care in the greater Bluffton area. We're able to administer all medications on site with our infusion team, including chemotherapy, immunotherapy, and other medications, while patients also have the ability to meet with our nurse navigators, pharmacy team, and other medical teams all under one roof.
Yeah, that is really incredible. And in previous episodes, we've even got some, talked to some patients here about really how impactful and beneficial that is. We have a minute and a half or so left, and I want to know what you see is the future of treatment and care.
Yeah. As a young medical oncologist new to the area, It's a really exciting time for me to be practicing medicine and to be involved in the care of our cancer patients. We're now moving away from things like chemotherapy, which generally have a stigma of hair loss and nausea and some potential toxic side effects, and are now incorporating up-to-date, evidence-based approach cancer care. This is from both a concise and data-driven perspective, but also from a compassionate mindset as well.
Yeah, really great information, and thank you so much for taking the time to really explain what that personalized care looks like here at St. Joseph's Candler. Thank you so much.
Thank you.
After the break, we're going to dive into breast cancer research and care. Of course, October being Breast Cancer Awareness Month, really great information. We hope you'll stick with us here on Living Smart in the Lowcountry. Welcome back in. You're watching Living Smart in the Lowcountry. We're here at St. Joseph's Candler, of course, and if you're just joining us, tackling some big topics today. Right now, we're going to check in with Dr. Gary Thomas and talk about breast cancer and the state-of-the-art treatment that they have here at this facility. Thanks so much for joining us.
Thank you for inviting me.
Gosh, we have really a lot to talk about in just a short time. I want to start though with how has breast cancer treatment really evolved and changed over the course of just since your career has begun?
Well, it's amazing to see the improvements we've made over the last 30 years. I've been an oncologist now for over 30 years. It's hard to imagine. And the treatments have really evolved amazingly well. I never thought I'd see all these improvements over that period of time. Surgery, which is one of the backbones for breast cancer treatment, has really de-escalated, believe it or not. So when I was a young doctor, the theory was to cure a patient, you'd have to remove the entire breast. And they would remove the breast, mastectomy, they would even take the muscle underneath. It was a very disfiguring surgery. And now we're able to do lumpectomies where you just remove the tumor itself with a normal margin around and then follow that up with radiation. That's an option for most women. So it's the theme of the breast cancer advancements has been de-escalation of therapy.
Wow.
So that's been great. The radiation is more effective, more targeted, and that results in less side effects and much shorter treatment times.
What a huge, amazing outcome for the patient then, just not having to deal with, such trauma after the fact. So that all sounds amazing and part of the state-of-the-art treatments, but talk to us a little bit more about some of the state-of-the-art treatments that we can really see here.
Sure. Well, one thing I would like to add is we give about 70% less chemotherapy than we did, say, 10 years ago. And that's because of the personalization of the tumor. Now we can look at a tumor's DNA and determine which women really need chemotherapy and which don't.
Wow.
And it's called a 21 gene recurrence score, and it can give prognostic and predictive information. So it can really predict what a woman's outcome would be, say, 10 years from now with or without chemotherapy. So it spared so many people from having to take unnecessary treatment. So that's a big plus for breast cancer treatments. You probably have heard of immunotherapy, where you're actually receiving an infusion where you're trying to rev up your own body's immune system to attack the cancer cell. So many cancers, melanoma, Hodgkin's disease, lung cancer, for instance, those treatments have been revolutionary. Breast cancer, it's lagged behind a little bit, but more recently we found a particular subset of breast cancer called triple negative breast cancer, a very aggressive type breast cancer, usually seen more often in African American women or Hispanic women or younger women in particular. If you combine that with chemotherapy, you can have dramatic shrinkage of the tumors and very good outcomes. So we're really excited about that. So immunotherapy is one. There's another class of drugs called antibody drug conjugates, which are really new type treatments in cancer medicine. They're sort of smart bombs. They're like a Trojan horse, where it's like chemotherapy in the sense that you inject it in, but it targets the cancer cell itself, and then it opens up and hits the cancer cell. So there's less side effects, more efficacy. So those are two areas where I'm really excited about.
That's incredible, yeah, and having less side effects, obviously amazing for the patient. Let's discuss, gosh, we have a minute and a half left, but I want to talk about how being a research facility really is a benefit to your patient. What does that mean for them?
Clinical trials is really the backbone of oncology advancements. So all these things I've been talking about all came as a result of women getting into clinical research studies. So we're very blessed here at the Lewis Cancer Center that we have a team dedicated for that. We have 2 oncology nurse navigators, so to speak, that help us identify if a patient would be a good candidate for a clinical trial. Now, trials are not for every patient. Some patients are afraid of them, but if we identify a trial that might be very helpful for a patient, we always encourage them to at least consider it. And through the Lewis Cancer Center, we have a nationwide reach where we can participate in these national trials. So it can be very, very helpful. I always believe that you should always have as many smart people getting on your case as possible. So we collaborate with cancer centers all over the country. Sloan Kettering, MD Anderson, Mayo Clinic, MUSC. So we're very excited about the things that we can offer to patients here in the Lowcountry.
Absolutely. Well, your patients are in good hands here at St. Joseph's Candler. Dr. Thomas, thank you for taking some time with us today.
It's my pleasure. Thank you for having me.
We appreciate it. We'll be back with more Living Smart in the Lowcountry. We hope you'll stick around. You're watching Living Smart in the Lowcountry at St. Joseph's Candler, really learning a lot about cancer care. Right now, we're going to switch gears a little bit to talking about prostate cancer. This is one that I know a lot of our viewers want to know about. Dr. Shaheen is here to tell us a little bit about it. Thanks for joining us.
You're welcome. Thank you for having me.
Let's kick it off today, Doctor, with a question about PSA level. This is something that can get our discussion going. I really would like to know basically what it is and what it means.
PSA is short for prostate-specific antigen. It's actually a protein produced by the prostate tissue. And the higher the volume of that tissue, the higher the level of PSA. It is produced by cancer cells as well of prostate origin. And because of that, the rise as well makes you suspect there's the presence of cancer. So typically, an enlarged prostate that's benign can have an enlarged PSA up to a level. Beyond that, you start suspecting that maybe there's cancerous tissue that's either in that location or elsewhere in the body. And that's why it's used as a specific marker or a screen for prostate cancer. Bear in mind, it could be increased sometimes in inflammation. So when it is tested as a screening tool, the person hopefully would be without any serious problems or symptoms at that time.
Okay, interesting to know that. Let's talk a little bit about strategies when we're talking about prostate cancer to really help with detection. Let's start there.
Well, there's really the most important tool at this point, which is evolving really, is to understand which person is at higher risk. So there is risk stratification for individual without any problems or symptoms that are getting screened. For example, ethnicity. African Americans have a higher risk of prostate cancer, especially for us in the Lowcountry, and it is typically more aggressive. So you want to start your screening earlier if you're African American at age 40. You need to check as well the family history, which is very important, and other factors including smoking, weight, exercise. So typically you can start screening for higher risk at age 40 and at 45 for average risk. That's the initial assessment. Once you suspect that there's potential cancer and you establish the first biopsy, then there is risk assessment as well for that individual with the diagnosis to realize if this is a aggressive or non-aggressive disease. So quite a few strategies are involved with that, from mapping the prostate with a MRI, assessing systemic evidence of disease, the level of rise of PSA. So quite a few things that the physician will implement to actually follow that individual and move them in the direction of speedy management or a short wait and see pattern, just basically to make sure that we're not intervening in things that doesn't require intervention. For an elderly person, for example, of this diagnosis who has a low-risk disease may live their lifespan and not have to deal with it.
Yeah, and that would be obviously ideal. We've only got a minute left, but I want to make sure we talk about various treatments, of course, and what somebody might go through for an aggressive or non-aggressive tumor.
Well, I touched quickly upon the fact that you might want to monitor certain people with low-risk disease, multiple other risk factors in their life, they may not really need to intervene with this cancer. Now, the more aggressive disease, there's clearly early stage and advanced stage, and that's where the screening comes along. The earlier the stage is, the more likely the curative intent, and the more advanced stages require us to be a little bit more of control the disease and prevent it from causing any problem. And one of the newest tools that we have is the molecular markers in those cancers. We look into the genetics, and the genetics can tell us sometimes how aggressive the cancer is, but not just that, it can point us towards specific treatment for that individual that may not be what we treat generally everyone else. So it is an important part of assessment initially for that therapy. Now, of course, now we are doing a more aggressive, specific, localized treatment in radiation like CyberKnife, and we are doing a lot more targeted therapies for the advanced disease.
Okay, all great information. Dr. Shaheen, thanks so much.
You are welcome. Thank you for having me.
If you're just tuning in, this is Living Smart in the Lowcountry, and we're here at St. Joseph's Candler. Right now, we're going to talk with Beverly Balance. She is the Compliance and Quality Manager here. Thank you so much for joining us.
Thank you. I'm glad to be with you.
So we got a lot to discuss. First of all, I've heard of this COPI accreditation. Let's talk about what exactly that is.
So I like to think of COPI as sort of like the Good Housekeeping seal of approval for oncology practices. So we've actually had COPI certification, which is Quality Oncology Physician Initiative, and it's a certification that we first obtained in 2016 and then re-obtained in 2019, and actually October 2022 will be our next survey, October 5th. So we're preparing for that and expect to get certified again. So that's good, and it basically is looking at your overall practices, how you provide oncology services, including chemotherapy administration, your services, nursing services, supportive services, and physician practice.
Wow, sounds like it's something very important and wonderful to have. I would love to know, the specifics, or even just a broad view of how this can benefit the patient.
Well, it lets the patient know that we're delivering the highest quality oncology care all the time. So we're looking at all those areas. There's actually 4 domains that we are working toward, and we work continuously at improving what we provide as far as oncology care. And it includes our navigation services, our nursing services, our dietary services, looks at all the service lines that we provide. There's only 300 COPI sites, approximately 300 in the whole country. So that sort of tells you, what a select group it is and how special it is that the practice has achieved that, and especially going on the 3rd time. So I think it should assure patients that they're getting really high oncology care. So we strive to have our nurses nationally certified in oncology. We have to meet standards for our pharmacy staff, for our supportive services, and so it is sort of, like I said, the Good Housekeeping seal of approval for oncology.
Yeah, that's a great way to put it. Let's talk a little bit about your strategy here of having a really integrated, multidisciplinary team. How does that fit into really the overall goals of COPI and how you are able to really deliver the highest quality of care?
So the very essence of COPI is integrative and multidisciplinary. And the domains I talked about, the 4 really focuses on a multidisciplinary and collaborative relationship with patients. And the actual start of the survey is a submission of data that supports that you are providing a whole continuum of care. So to me, COPI drives that whole service initiative for us.
Absolutely. Well said. It sounds like this accreditation is very important to your patients, and having you at the helm here making sure that everything is in compliance, I'm sure is greatly appreciated as well. Thank you for walking us through that and its significance here. We appreciate you.
Thank you, Jenna.
Absolutely. We'll be back with more Living Smart in the Lowcountry. We hope you'll stick with us after the break. Thank you for joining us today. We hope you found this both educational and beneficial. For more information on this program or any of the services provided by St. Joseph's Candler, please visit their website at sjchs.org. We'll see you next time on St. Joseph's Candler's Living Smart in the Lowcountry.